is Candace Rennick. I'm the Secretary Treasurer of CUPE Ontario. I will be moderating the town hall this evening. We're hosting this town hall on the employer vaccine policies. We know this is a super hot topic for folks. We've got lots of people joining the call tonight, so we're just gonna give folks a few minutes to get on before we get started. Just want to cover off a couple logistical items with you all this evening. We are providing simultaneous French translation. So if you wish to participate and to listen to the event this evening in French, you will see a globe icon at the bottom of the screen. You can click on that globe icon and select your language. So obviously, if you want to listen to the event in English, you will click English. And that will ensure that anytime a French speaker comes on, you will still be hearing the town hall in English. So again, we are going to get started in just a few seconds. We've got a super exciting lineup for you tonight. We've got Fred Hahn, the president of CUPE Ontario. We've got Paul Sylvester, our health and safety representative. We have Daniel Shepard, a lawyer from Goldblatt Partners. And we have Dr. Tara Moriarty, who is an infectious disease scientist at the University of Toronto. So I am told by our technician that the numbers are still climbing. We had thousands of people register this evening, so we're going to just give folks a little bit more time to get on. Really appreciate you joining us tonight. We are going to last the call about 90 minutes. We have 90 minutes, so the vast majority of the time this evening is going to be for questions and answers. The way that you will interact with the town hall this evening is by typing in the Q&A section at the bottom. You'll see the Q&A icon at the bottom. The chat has been disabled and we will not be recognizing any raised hands. So the only way that you'll be able to interact is by typing your chat in typing your question in the Q&A chat, and I will read your question out. I will not be attributing names to any of the questions, so all of the questions will be anonymous. So again, we will not be recognizing any raised hands, and the only way that you'll be able to ask a question is by typing it out in the Q&A. We've also received dozens of questions in advance, and we will be asking some of those up front as well. Okay, so our technician has advised that we're going to get started. I think I've covered off everything that you need to know right now. Just for those of you who have just joined us, the globe icon at the bottom of the screen allows you to select your language. If you wish to listen in French, please select French. So thank you so much for joining the call. I'm Candace Rennick. I'm going to be your moderator for this evening. And without further ado, let's jump right into it. I'm going to turn you over to the president of CUPE Ontario, Fred Hahn. Go ahead, Fred.
Thanks, Candace. And hi there, everybody. I want to thank you for being here. I'm Fred Hahn. I'm the president of CUPE Ontario. I'm zooming in from the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It's important to recognize the land that we're on, to have that recognition and our desire for truth and reconciliation with Indigenous communities center us in every conversation we have as a union, including this important one we're going to have tonight. We're joined this evening by our moderator, CUPE Ontario Secretary Treasurer Candace Rennick, CUPE National Health and Safety Representative Paul Sylvester, Goldblatt Partners lawyer Daniel Shepard, infectious disease expert Dr. Tara Moriarty, and CUPE members like you from across the province. We're here tonight to talk about employer vaccine policies. We'll talk about the nature of those policies and what they ultimately mean for CUPE members. But before we go there, I do want to start with a sincere thank you to all of you from the bottom of my heart for the work you do every day in our communities. You have been the backbone that has kept things going, kept Ontario going during the worst global pandemic of our lives. All of us in communities across the province owe all of you and our members our deep gratitude. That includes CUPE as your union, but as your union, we also owe you the best that your union can give. Our best representation, our best advice, our best activism, and our understanding. Vaccine policies vary from employer to employer. And these policies have caused confusion, and they can, for some of our members, provoke anxiety. These are not our union's policies, but we are here to help our members navigate them, to provide you with the best information we have. I want to remind you that from the very beginning, when vaccines first became available, the position of our union has been consistent. We've said from the beginning, based both on science and evidence, and now, frankly, now hundreds of millions of doses being administered, that vaccines are both safe and effective, and that everyone who can be vaccinated should be vaccinated. We've said this based on the foundation of our movement, the labor movement, which is based in collective action and the importance of solidarity. It's an expression of solidarity to ensure that your coworkers are safe at work. It's an expression of solidarity that we do all that we can in this horrible situation to fight to keep everyone as safe as we can. Our families, our coworkers, those we support and provide service to in the community. But we also know that we have members who are hesitant about becoming vaccinated. We know that for some communities, there are real worries in terms of their history with the medical establishment, particularly Black, racialized, and Indigenous members, for example. We want to listen to those of you who may be hesitant, and we want to be able and will defend the rights of those who may be exempt. But we also know there are many other important ways to keep ourselves and the public safe when it comes to COVID-19. All of this focus on vaccination cannot have us forget the need to continue to advocate and to get the best available personal protective equipment, or PPE, for our members, to enhance and improve ventilation in our workplaces, to push for safe spacing at work, for masks, for hand washing, for all of the other critically important pieces we must work on together to keep ourselves and others as safe as we can. I want to underscore that this is a safe space. People can ask the questions they need to ask, come forward, and do that without fear or ridicule or retribution. With respect to anything that's on this call, we will respect one another in our union and in our movement, as we do in all the things we do together to fight for a better world. Now, having said all of that, I'll ask Candace to come back on and to get us started. Candace, over to you.
Okay, thanks so much, Fred. So the information on the call tonight is really super important. We know, and understandably, this has attracted a lot of controversy. People have a lot of questions, a lot of concerns, and they want answers, and that's why you're here tonight. So I want to underscore that our primary goal is to uphold the safety and the rights of CUPE members. These have been incredibly trying times for CUPE members. We know that some of you have faced heartbreaking conditions at work. We know that others of you have faced increased precarity. We know that all of you have faced severe disruptions in your normal lives, disruptions that have negatively impacted your family and your mental and your physical well-being. This pandemic has been disastrous, but it has also reminded us of some things that we had forgotten. It's demonstrated the importance of your work. It showed how much your neighbors and your communities depend on you. Your heroism has not and will not be forgotten. And we will try to honor that heroism now in answering to the best of our ability the questions that you have this evening. So as I said earlier, to ask a question this evening, please use the Q&A feature at the bottom of the screen. All of the questions will be posed anonymously. Our team will gather them. I will ask the questions, and our experts who are here this morning or this evening, excuse me, will be helping to answer these questions. So I'm going to turn it over to our first panelist. We're joined by CUPE National Health and Safety Representative Paul Sylvester to make his presentation. So please go ahead, Paul.
Thank you, Candace, and welcome everyone who has joined us tonight. I'm just going to share a presentation because I'd like to make a presentation tonight about why it is still important that with the introduction of these mandatory vaccination policies that may exist, that we not lose our focus on the additional health and safety measures that are required at this time. Okay, so just hit this right here. Okay, so No, tonight is that the province has loosened public health restrictions, despite the fact that we're in a fourth wave. And vaccines can help prevent infection and disease transmission, but employers must reassess the risks. And workplace control of COVID-19 exposure risks must increase. And that COVID-19 resources are available at qp.ca Health and Safety. So here's why we're here. Why we're here now is because we are in a fourth wave, and the majority of the cases are unvaccinated individuals. The Delta variant has become the dominant strain of SARS-CoV-2 in Ontario. You'll see in the previous weeks we had the Alpha variant, and now the Delta variant has come in strong, as now representing nearly all cases in Ontario. So based on the emerging data, what do we know about the Delta variant and the unvaccinated? Well, we know there's increased risk of infection, including higher case rates among children. We've seen increased risk of transmission. Unvaccinated individuals have longer infections and have a higher viral load of live virus. Increased rates of infection and severe outcomes for unvaccinated individuals. And that natural immunity from a previous infection might not be effective. And that is why they're recommending that you get a vaccine, a full dose of the approved vaccines if you've had a previous infection. And consult your healthcare provider on that topic. We've seen increased risk of breakthrough cases amongst the fully vaccinated, although it must be stressed that efficacy remains strong against infection and severe outcomes. And vaccines will help end the pandemic, but until that time, employers must continue to ensure that health safety procedures are implemented in consultation with the Health and Safety Committee or your health and safety representative. These measures and procedures are reassessed, and they must be reassessed based on the emerging evidence or in light of new information. And as we've seen with the Delta variant, the increased risk of transmission, the recognition of airborne transmission, which the science is coalescing every single day, and it's an accepted fact. Still, some workplaces still haven't adopted anything to deal with the airborne risk of transmission. So what should employers do? Well, they need to reassess the risks of exposure based on the increased risks of Delta variant and airborne transmission. And they need to continue to adopt a precautionary approach towards occupational health and safety. And they must not accept a public health wait and see approach. And that is a clear difference that you would see between occupational health and safety and public health and safety, is that there is mitigated risks that are adopted within public health, where they will see if the cases rise and then adjust accordingly. Well, in occupational health and safety, we know that the employer should start at taking every precaution reasonable to prevent those risks of exposure before waiting to see. And only then, when we can determine that it is safe, should you remove any kind of control measure. And we start with the best protection before removing any other layers of protection. And when we talk about layers of protection, we need to remember this concept that not all of the layers of health and safety measures for COVID-19 are going to stop the virus. And that includes physical distancing, masks, washing your hands, cleaning and disinfecting, avoiding crowded spaces, ventilation, screening for self-screening for symptoms, or active screening for symptoms. These all have holes in them. But vaccine represents probably the strongest layer at preventing exposure risks and preventing risk of transmission. Just like all of these others, there are no 100% guarantees, but the data and the science is out there on the efficacy of vaccines, and that will help us end the pandemic. So if you are a member of the Joint Health and Safety Committee, or you're the health and safety representative at your workplace, remember the hierarchy of controls, and that we need to start the conversation by saying who is required to be in the workplace first of all. You know, is it essential to the operations of your workplace that you be at the workplace? Have we identified those who can still work from home? And concentrate your efforts on the engineering controls, which I spoke about earlier, which is ventilation, barriers, and screening. Those are important engineering controls because we know the next point is PPE, which is proven to be the least effective means of protecting workers. So let's not have so many conversations about masks, and although they are important, we want to make sure that the higher degree controls are contemplated. And CUPE can help. The Health and Safety Branch has developed resources which are available at Safety. And they include a risk reassessment checklist. There's an assessment for aerosolization of the virus. And there's a general health and safety system checklist to determine whether or not your employer is implementing effective controls against COVID-19. There is a piece on ventilation. You know, talks about filters, talks about the air purifiers that are out there. We have a new fact sheet about variants of concern and what are they and why they are important, because we know that if there is uncontrolled spread, there is a higher risk that there are more variants that are going to emerge. And we've seen variants emerge is from places that have high rates of uncontrolled spread. And we know, excuse me, we also have a new tip sheet for dealing with government health and safety inspectors. When you are considering calling in the Ministry of Labor to do an inspection or to solve a health and safety problem that you have at your workplace, it's a good idea to review this tip sheet to ensure that you're prepared, and that when they come on board to your workplace that you'll know what to say and how to react. And a new, one of our new mental health resources is about psychosocial and psychological approaches to hazards in the workplace. It's within our mental health page and discusses how we need to remove psychosocial hazards from the workplace and not concentrate on what's called psychological illness or psychological makeup of the worker. Because when we concentrate on the worker, you know, we're not concentrating on the hazards that are present in the workplace. And if we focus on the individual, the hazards will remain in place, and it's just a matter of time before the workers encounter those hazards. So as I mentioned before, the health and safety resources, this presentation will be uploaded to the CUPE Ontario website. And I've added a few more resources here from the Canadian Centre of Occupational Health and Safety and from the Occupational Health Clinics for Ontario Workers. And I've also included from the World Health Organization, a roadmap to improve and ensure good ventilation in the context of COVID-19, which includes strategies and flow charts that you can use to ensure that the best possible ventilation interventions have been implemented. So thank you, and I hope to answer any questions that you might have. Thank you.
Great, thank you so much, Paul. And some people are asking questions about, you know, is this presentation going to be available? Yes, as Paul has indicated, we're going to be posting this information on the website. One of our staff will post in the chat the link where you can access it. And also folks are asking, is this being recorded and can this recording be shared afterwards? And the answer is yes, we are recording tonight's town hall and we can share it after in an appropriate forum. So I'm now going to turn it over to Daniel Shepard. Daniel Shepard is a lawyer with Goldblatt Partners, and he is here this evening to talk to us about the legalities concerning employer vaccine policies. So Daniel, take it away.
Hey, thanks so much, Candice. I'm going to do a brief presentation, kind of providing you with the basic overview of your main rights and some of the law that are relevant to employer vaccine mandates. But really, what I'm most interested in doing today with all of you is answering your questions. So I'm going to keep it a little bit short, but if there are topics that I don't address in my presentation today, please don't hesitate to put those questions in the Q&A section, and I'm going to do my best to give you the best information that I can. And it's important for you to get the best information that I'm able to provide, because it's very clear that workers today are going to be facing some decisions. And for many of you, those are going to be very difficult decisions to make about whether or not to become vaccinated, to submit to testing, to disclose medical information. And as you make those decisions, it is crucially important for you to understand what the consequences of those decisions might be. And so my presentation is going to really try to address what some of those consequences might be, so that you are in a more informed position to make decisions for yourself about whether or not to vaccinate. The first question that I always get is, can my employer impose a COVID vaccine requirement in my workplace? And the answer is yes, but there are limits to what they can require. They can very likely require you to disclose your vaccine status and to provide evidence or proof of your vaccine status. But when they do so, they have to take measures to ensure that your privacy is respected and that that vaccine status information doesn't go further than is necessary to implement the policy, and that isn't going to be accessed by individuals who don't need to know. They can require workers to, well, let's put it this way. They can't require a worker to become vaccinated against their will. But what I mean by that is that they can't, physically hold you down and inject you with a vaccine while you shout, "I do not consent." What they can do is to give you the option of whether or not to vaccinate, but subject your decision to consequences. So just because there may be certain consequences that flow from a decision not to vaccinate doesn't mean you don't have a choice. The case law is fairly clear that at least some negative consequences for choosing not to vaccinate are acceptable and still leave you with an honest choice. The uncertainty lies in terms of where is that dividing line between a choice that comes with difficult, painful consequences and something that's not actually a choice at all. But I just want to say that just because you feel pressured to become vaccinated doesn't mean that this constitutes removal of your choice in terms of what you're going to do to your own body. The law draws important distinctions between different kinds of choices. The next question I get is, well, what happens if I choose not to become vaccinated? My employer has a mandatory vaccine policy. It says I have to become vaccinated. I make the choice not to. What are some of those consequences that you might face? Where is that dividing line between putting pressure on you to vaccinate versus coercing you or effectively forcing you to vaccinate? I can't answer that question with certainty because we don't have court decisions or labor arbitration decisions that have considered the current COVID pandemic. What I can do is that I can go back and look at the last 30 years of case law about influenza vaccine policies, because we have a lot of experience with employers mandating vaccination for their workers for other diseases, most commonly flu. Those cases suggest that there can be a range of consequences that can face workers. For example, those cases support the view that workers can be required to be subjected to periodic screening, in this case, rapid testing, if they are not vaccinated, as a precondition to entering the workplace. The case law suggests that workers can be put on modified job duties or assignments to reduce the risk of spread. So decreasing the amount in which they interact with vulnerable populations or members of the public or with coworkers. There's also quite a bit of case law that suggests that unvaccinated workers can be placed on unpaid leaves of absence if they choose not to become vaccinated. And this is an area where the uncertainty in the COVID context begins to increase, because this is an area where COVID looks different than the flu. Arbitrators have uniformly across Canada said that workers who refuse to have a flu shot can be placed on an unpaid leave of absence, but those unpaid leaves of absence are for a couple of weeks. When we're talking about COVID, it's potentially much longer than that. And so I can't tell you with certainty whether or not they would be allowed to do so. But what I can tell you is that there are 30 years worth of court decisions and arbitration decisions that support an argument that employers can place unvaccinated workers on unpaid leave of absence. Employers have flexibility. They don't have to stick to only one set of consequences. They have a range of options that will be open to them. But the biggest question, and the one I know is on most of your minds, is can I be fired for refusing to be vaccinated? And this is where I really don't know. It is completely untested. In the flu context, all of the policies that have been subject to review and that have been upheld have all been very clear that one of the reasons why they were being upheld is that people were not being terminated. There hasn't been a case in which a policy that results in someone's termination has actually been litigated. And so all I can tell you as you make that decision for yourself about whether or not you want to be vaccinated is that there are going to be arguments that employers can credibly make that say, yes, they can fire you. But equally so, there are arguments that union side lawyers like myself can credibly make that say, no, that goes too far, that undermines the actual free choice of workers, and that is something that employers are not allowed to do. I think that the arguments that I would be making against terminating workers who choose not to become vaccinated would be strong arguments, would be good arguments. But I would also be doing you a great disservice if I told you I knew my arguments would win. I don't know that. All I know is that there are going to be arguments on both sides that arbitrators and courts are going to be listening to, and that we have to wait to see what the outcome is. And I know that puts you in a difficult position because you have to make the decision whether or not to become vaccinated now. And so you simply have to make that decision understanding that for those employers that say, we're going to terminate you if you choose not to do so, there is a high degree of uncertainty about whether or not at the end of the process for grievances and for arbitrations, there's a great deal of uncertainty whether or not they will actually be allowed to do that. That's a question that no credible lawyer will be able to answer for you with certainty. The other big question I hear is, well, what about discrimination? What about accommodation? And this really gets to the Human Rights Code. The Human Rights Code of Ontario is going to provide people with the main source of protection against employer vaccine requirements. And that's because no matter what the employer's policy says, for those workers who are in sectors in which there are actual government requirements to put in those mandates, no matter what those government mandates say, everyone must comply with the Human Rights Code. And the Human Rights Code says that you as a worker have the right not to be discriminated as a worker on the basis of certain protected grounds. Not every distinction between different groups of workers violates the Human Rights Code. You have to fall within one of the listed grounds under the code. And in the context of vaccine mandates, it's really two grounds that are going to be the most important: disability and creed. I'm going to discuss each one in turn. Disability is the easier one because it's the one that says if you have a medical condition that prevents you from being vaccinated, the employer has an obligation to accommodate you. Your medical condition has to be supported by objective medical evidence. So it means you can't just say yourself that you have a medical inability. Your physician, your nurse practitioner, a specialist has to certify that that is correct. And it has to relate to the specific vaccine at issue. The fact that you may be allergic to a flu vaccine doesn't matter. What matters is, do you have a medical condition that prevents you from having one of the COVID vaccines that are on offer? If you have a concern about the safety or the efficacy of COVID vaccines, that is not a disability because it's not a medical condition. It's a concern on your part. It may be one that you hold very deeply. It may be one you take very serious, but it's not a medical condition. And so the Human Rights Code does not apply to it. What it protects against are things like allergies to specific ingredients that you can point to in a list of ingredients in one of the vaccines and say, I will go into anaphylaxis if this is administered to me. The other ground I mentioned is creed. Creed is a kind of a amorphous concept. Normally, it means religion, but it may mean more. There are going to be certain non-religious creeds that are still protected by the Human Rights Code. But in general, it has to be an organized belief system shared by others that relates to all aspects of your life and deals with really fundamental questions like the nature of what does it mean to be alive, what happens after you die, what is a person's role within the universe, does there exist a creator or do there exist higher planes of existence? It's those organized systems of thought that are protected by creed. And if your organized system of thought includes a sincerely held belief that prevents you from being vaccinated, you are also entitled to an accommodation in your work in the same way as a person with a disability is. But it's important to note that creed only goes so far. Creed doesn't protect things like an objection to vaccination. It does not protect a preference against vaccination, and it doesn't protect a wide range of objections to vaccination that are not rooted in one of those comprehensive systems of belief that are shared by communities. But let's say you have either a disability or a creed-based accommodation need. What does accommodation actually mean? The Human Rights Code says you have the right to reasonable accommodation up to the point of undue hardship. And what that means is that you don't have the right to your treatment of choice. You have the right to a process that involves you, your union, and your employer considering your own unique individual accommodation requirements, your employer's requirements from its workforce, your job duties, and considering all of those, coming up with a set of accommodations that are reasonable in the circumstances that don't go so far as to place an undue burden on the employer. That's what the Human Rights Code demands. And so what does that mean in practice? Well, again, there is no one-size-fits-all answer. Accommodation is going to be on a case-by-case basis. What is a reasonable accommodation for one worker may not be a reasonable accommodation for another one. And equally so, we don't have very many accommodation cases in the COVID context, and so there's not a lot to work from. But again, looking at vaccine jurisprudence, vaccine law with respect to other diseases gives us a sense of what are some of the things that might be reasonable accommodations for individual workers. That can be things like modified job duties. It can be things like paid leaves of absence as opposed to unpaid leaves of absence. And it can involve rapid testing as an alternative to vaccination. Now, again, I want to emphasize, I'm not saying that that's what employers are not allowed to do. It is very individualized, and it may be that what were reasonable accommodations in the context of a flu endemic, in which there would be a few weeks during the year where a workplace would have a flu outbreak, may not translate over to a global pandemic involving COVID. But it does give you a sense of what we're talking about and what we're thinking about when we say, what does it mean to accommodate workers who are protected by the Human Rights Code? The last thing we're going to talk about very briefly, although I'm happy to get into more detail later, is what about the Charter of Rights and Freedoms? So I know many of you have questions about the Charter. Isn't this all unconstitutional? And it's a difficult question to answer in the abstract, but let me try to sketch out kind of a framework that I use as a constitutional lawyer to think through this question. So the first question I have to ask is, does the Constitution even apply to your employer in the first place? Because CUPE members work in all kinds of different workplaces, and sometimes their employers have to comply with the charter, but sometimes they don't. So for example, municipalities are subject to the charter in their relationship with their workers. On the other hand, hospitals are not subject to the charter in their relationship with their workers. That may seem unfair and that may seem arbitrary. I can't answer those types of concerns. What I can do is inform you about what the law is. And since 1990, the law has been clear that that is a distinction that is drawn. And so if you happen to work in a hospital, the answer is no, the hospital's policy isn't violating your charter rights because the hospital doesn't have to comply with the charter in the first place. But assuming you're in one of those workplaces where the charter does apply, then the question is, well, what's the specific charter right that's being invoked? And there are certainly many of them that seem to apply to this type of situation. But many of them really aren't going to change the analysis from what the Human Rights Code says. So for example, the charter protects freedom of religion, but the Human Rights Code protects creed. And your protection under the charter really doesn't go further than your protection under the code. So if you're protected under the code, well, then you're protected. And if you're not protected under the code, you're probably not going to be protected under the charter either. Similarly, disability. The charter protects against discrimination on a number of grounds, including disability, same as what the code does. Analysis not going to be fundamentally different there. In fact, when it comes to disability, there's an argument that the code may actually protect you more than the charter does. What about forcing people to disclose information about whether or not they're vaccinated or provide testing results? What about your right against unreasonable search and seizure? And that's a good question. But bear in mind, the right under the Constitution is not a right against search and seizure. It's not an absolute protection for your privacy rights. It's against unreasonable search and seizure. And there are many things that the government does that invades your personal privacy that are nevertheless found to be reasonable searches and seizures that would be upheld under the charter. And I mentioned before, employers are allowed to require you to disclose this so long as they protect your privacy. Well, the protection of your privacy, right? Making sure that only the need to know people actually get access, making sure that this information is stored in a secured environment. Those are the sorts of things that are going to be highly relevant to a court or an arbitrator deciding whether or not the employer's seizure of your personal health information is or is not reasonable. And the last one is, well, there's something called Section 7 of the Charter, right to life, liberty, and security of the person. In fact, this is the area of constitutional law that I specialize in. It's a very complicated area. There is no clear answer in this field. Certainly, there is a lot of case law that talks about your right to make informed choices about what you're going to do to your body, choices about medical freedom, why you can't have medical treatment without your consent. But remember where I started the presentation. The courts also draw a distinction between a forced medical procedure, right? Literally holding you down and sticking a needle in your arm against your will, versus choices that are made, even if those choices are subject to negative consequences. So it's true, the charter does protect your right against forced medical procedures, but the fact that you may, for example, be put on an unpaid leave of absence if you don't get vaccinated doesn't mean, from the perspective of the charter, you are subject to a forced vaccination. And in particular, employers are going to say, well, there's a lot of law that says that nobody has a right to work any particular job. There are many cases in which individuals have tried to invoke Section 7 of the Charter to say, I'm going to be fired if I don't comply with this obligation my employer is trying to impose on me. If I'm fired, it's going to impact my security of the person because I'm going to become homeless. I'm not going to be able to feed my family. I'm going to have really dire economic consequences. And the courts have said you don't have a constitutional right to your job. And so Section 7 of the Charter isn't invoked at all. But there are other arguments that I would be willing to make. They may be weaker arguments. They may be difficult arguments to say that when it comes to terminating an employee, firing a worker based on a choice about undergoing a medical procedure or not, that does go too far. And that does step over the bounds and start getting into areas that may be unconstitutional. But again, I come back to where I began, which is there is a lot of uncertainty in this area. And that when you make the choice about whether or not to become vaccinated, you're faced with the difficult reality that you're not going to have a clear understanding necessarily of what all of the consequences you may be facing really will be. Some of them I can tell you with a high degree of certainty what's going to happen, but there are some which I simply can't do so. But that being said, I really do thank you for your attention. And I do look forward to answering as many of your questions as possible, because it is so important for you to have as good an answer as you can to your legal questions.
Great. Thank you so much, Daniel, for sharing that expertise with us. We're going to try to get to the questions just as soon as we can. I want you all to know we have thousands of people on the line tonight. We're already up to almost 100 questions, or sorry, excuse me, 900 questions in the Q&A. We are not going to be able to get to 900 questions tonight, but we're going to do our best to get to as many as possible. I'm now going to turn it over to our last panelist before we open it up to those questions, Dr. Tara Moriarty. She is a infectious disease scientist at the University of Toronto. And Dr. Moriarty, if I could, just before you get started with your results, just because we do have so many questions, I'm just going to say to you, some of our questions are, is it true that Health Canada hasn't approved this vaccine? And another question is, is this vaccine really safe? Tons of people are experiencing adverse reactions from it. And one of our members is saying, isn't it true that more people have died from this vaccine than all other vaccines combined in the last 30 days? So a lot of questions and perhaps maybe misinformation about the vaccine. So I'm going to turn it over to you. You are the scientist and the expert on this question. Please take it away.
Thank you very much. So yes, there is some misinformation in there. So I'm going to try to answer and talk about as many questions as I can. But what I want to tell everyone is that an organization that I run, that's run by volunteers, provides drop-in sessions a couple of evenings a week that people can come and ask anonymous questions about the safety of the vaccines, concerns that they have about their loved ones and vaccine safety. And I'm going to drop a link to that as soon as I've answered this question. You can come back over and over and over again, share that. You can ask every question you want. And we have volunteer scientists, physicians, pharmacists, and we're all there as volunteers to extend a hand and to support people and never, ever to judge. Okay, so first of all, as Fred alluded to at the very beginning, the vaccines that are currently available in Canada are actually extraordinarily safe. So we have more data, more information about these vaccines than we've had probably in a short period for any other vaccine in history. And in fact, even for the side effects that are documented, for example, myocarditis in younger men and boys, the risk of these side effects is substantially greater from COVID-19 itself than from the vaccine. So COVID puts you at much greater risk than the vaccine. There are millions and millions of people that have been vaccinated, and regulators from around the world who are looking at these data independently and collaborating with each other. And you've probably seen some of that in the news over the last 6 and more months, where suddenly a vaccine will be paused while one government says, or one regulatory agency says, we think we saw this, and everyone gets together and works on it. So this is something that's being done independently by multiple countries around the world. And the other thing I wanted to emphasize is that we do know that vaccination side effects that do occur typically last no more than 2 or 3 months if they do. That's different than people who may immediately have a response to vaccination, like anaphylaxis, where they find it, where it becomes hard to breathe. This is a relatively common event in response to medical procedures. And I wanted to make sure everyone knows that vaccination teams are fully equipped to deal with anaphylaxis. They have adrenaline, everything else that's used to treat it, and it's something that's planned for and expected that if it happens, that they know how to deal with if it happens. So in that sense, there is a lot of misinformation. These vaccines are not killing people. And I want to actually talk about how many people in Canada are still likely to die because they have not yet been vaccinated. So we know, for example, that vaccination so far in Canada has probably saved about 430,000 lives. And the reason for this is that over the next 1 to 2 years, all of us essentially are going to be exposed to the virus that causes COVID-19. So with the vaccinations that we've done so far, we have saved hundreds of thousands of lives. And we're down to probably about the last 35,000 lives that need to be saved by vaccination. And what I want everyone to know, and I'm thinking about a question that I saw in the Q&A, is that this corresponds to 9,000 to 10,000 people of working age who could still die of COVID-19 if they're not vaccinated. Countless more people in their who are retired or who are older than 65. But this is a very large number of people, and many of us don't really grasp that maybe only 5% of the Canadian population has been exposed to the virus that causes COVID-19, and it's brought us to our knees multiple times, even with that tiny percentage infected. So I want people to understand, because I don't want to see this death. I don't want to see the long-term disability and everything else that ensues from these infections. But I want people to understand that your life may well be at risk, and the lives of people you work with and the people you love. But it is also crucial that every person be able to make good decisions about their own personal health and feel like they've made a good decision and be able to have all of their questions answered, get the information they need, and simply have people listen sometimes, take it seriously, recognize where the concerns are coming from, and then provide support. And so even though I care a lot about this, and I'm very worried about many Canadians still, which is why I'm doing this, I also really believe that we're not going to, it's not going to help people if we don't help people to come to decisions in the way that makes them feel safest. So with that, I can come back and talk about lots of other things about the number of deaths that may occur in different age groups and safety and efficacy and all that. I can answer all those questions, but I want to make sure people understand just how many lives are at stake right now, and why it's so important that we protect each other and ourselves from this.
Great, thank you so much. We are now going to move to the questions for all of you. We have about 42 minutes for questions. I think some of the questions may be redundant in that the presenters have already addressed them, but we're going to get to some of those again anyway, because I don't think it hurts to reiterate some of the things and to hear it in a different way. But one of the first questions that we have, and it's coming from several people, and it's asking about your rights to privacy and whether and in what circumstances you can be compelled to share your vaccination status. So Dan, can you speak to the privacy factor in all of this?
Yeah, I mean, there's two sources of privacy rights you have in the workplace. One is there a particular law, a statute that's been enacted that regulates the collection of your personal information with your employer? And then the other question is, well, if there's not, at what we call common law, do you have a privacy right that would protect you? So the first question, people often point to things like the Privacy Act or a statute called PIPEDA. Those don't apply because those only regulate the federal government. For CUPE Ontario members, you're more likely to fall under a statute called FIPPA, the Freedom of Information and Protection of Privacy Act, or its sister statute called MFIPPA, the Municipal Freedom of Information and Protection of Privacy Act. Those statutes do provide you with privacy rights, but they are limited, and they're limited in two different ways. So the first way that they're limited is that they don't impose a pure consent rule. The general rule is that these institutions can't collect personal information without consent, but there are a number of exceptions to that that do apply, including collecting information in order to implement lawful policies or to engage in lawful activities. And so that would likely apply to the collection of vaccine status information. The other, perhaps bigger challenge is that both FIPPA and MFIPPA have a provision that excludes a lot of information that falls within the labor relations context from the protections of the statute. So the reality is that those statutes really are more about protecting members of the public from collection of personal information by public institutions and don't really provide very many protections for the workers of those institutions. The protections really do come from the common law. So the courts have recognized that workers do have a right to privacy in the workplace. But again, it's not an absolute right to privacy. It's a qualified right. It's about a balancing of interests between the employer's workplace needs, their need to manage their workplace and their implementation of policies that they're allowed to implement on the one hand, and then balancing against that the rights of individual workers to personal privacy. And you kind of have to balance those two to understand how far can they go. That's a really abstract thing to talk about, but let me give you an example that actually has arisen in the COVID context. I've talked a lot about flu cases, but in the COVID context, we've actually seen in Ontario now a number of mandatory testing policy cases. So these are employers that have required their workers to periodically undergo rapid antigen testing as a requirement of going into work. One case is in the hospital sector, one case is in the construction sector, and one case arose in the food processing sector. So you can see a wide range of different kinds of workplaces where arbitrators have now asked this question: where is that reasonable balance in the context of information about whether a person is or is not infected with COVID? And all arbitrators have said that it is reasonable to allow employers to require workers as a condition of working to provide this information. So again, whether or not you would agree that that's a reasonable balance to be struck, from a practical perspective, you need to be aware that arbitrators have, in every case that has gone before them, concluded that it is reasonable to require them to disclose that information and have upheld those policies. And it's very likely that if you translate testing policy cases over to vaccination status cases, arbitrators would reach the same conclusion, because it's the same interests in terms of your right to personal information about your health versus the employer's need to have that information to manage its workforce and implement proper policies.
Okay, thank you so much. I want everyone on the line to know that we now have over 1,300 questions. So I'm going to ask the panelists to be as thorough as possible, but also as concise as possible, so we can try to get to as many questions as possible. This is a bit of a two-part question. Does the employer have the right to require us as a condition of employment to be vaccinated if we are working from home? And then the second part of that is, do we have the right to demand an accommodation from our employer to work from home if we choose not to be vaccinated?
So the first question is a really good one. There are definitely arguments to be made that if your job is one that literally requires you to never go into the workplace, and I mean not even one time, that there is a reasonable argument to be made that it's not a reasonable policy by the employer to require you to be vaccinated. Again, that case hasn't happened yet, so we don't know how an arbitrator would decide it, but it's certainly a stronger argument than for workers who have to go into the workplace. I can't say more than that. In terms of, do employers have to allow you to work from home as an accommodation? If you mean accommodation in the technical sense of an accommodation under the Human Rights Code for a worker who has a disability or a creed-based inability to become vaccinated, I certainly think that in an appropriate case, that would be a reasonable accommodation. Not in all cases, but in some. On the other hand, if you mean, can anyone who doesn't want to become vaccinated demand that accommodation? The answer is no, you cannot.
Great. Some of our members have expressed concern over the chemicals on the swabs and the rapid antigen tests. Can someone respond to the chemicals on the swabs?
I'll be happy to answer that question. So the swabs are a medical device, and Health Canada regulates the medical devices that are used in Canada. And just like all medical devices that are going to be used on someone or used in healthcare, is that there's a requirement that that equipment be sterilized. And there are different methods to sterilize medical devices. There's heat, there's using hydrogen peroxide, and there is steam as well. And there's also ionization that happens. But one of the methods is using a gas called ethylene oxide. And this has created a lot of confusion that I've read in that ethylene oxide is a very harmful gas. In fact, CUPE has a fact sheet on it. We've had a fact sheet for many years on the use of ethylene oxide. If you were to use it yourself in the sterilization process, and those who are exposed to the gas during the sterilization process has been the effects are well known. It is used less and less because of those properties. But what I can say is that any manufacturer that uses ethylene oxide gas to sterilize the medical device has to ensure that there is no residuals left on the swab. In particular, we're talking about swabs here, that there'd be no residuals that are left on the swab. And if there are residuals, for somebody who has to wear a medical device close to their body for like 24, 48 hours, there are what they call contact limits to ensure that not so many people are going to be exposed to a high level if there is any residuals that are still on there. It's important to remember that in that sterilization process, which is an international standard that is used across the globe, that part of the sterilization process includes the removal of any particular residuals that are on the swab. So by the time that the swab is sterilized and packaged and then pulled out again, there is negligible amount of ethylene oxide that should be any kind of residuals on those swabs.
Okay, great. Thank you so much, Paul. I feel like this was addressed in the presentation, but I'm going to ask it because dozens of people have asked this question. Can the employer terminate employment for non-compliance of the vaccine mandate? And I'll add to this because it's coming up in the questions. Can we be terminated for non-compliance of a vaccination mandate for failing to disclose our vaccination status or refusing to be tested? Daniel?
Yeah, we don't know the answer. That's the simple truth. We don't know. There are good arguments to say that you cannot be. But there are also good arguments to say that the law would allow that to happen. Until those cases have gone through the litigation process, no lawyer can honestly give you an answer to that. The honest answer is we're not sure how arbitrators are going to decide that question. And we're probably not going to learn that answer for months, if not years, is how long some of these cases take to be litigated. So I know that employers are saying that's what they intend to do, There are absolutely arguments to be made that that is not allowed, but until we actually get some court decisions or arbitration decisions, I can't answer that question. And you shouldn't probably, I would not trust anyone who says they know for certain what the answer to that question is.
Thank you so much. Next question, several people want to know, what is CUPE's position on vaccine mandates, and why is CUPE not defending the rights of members who don't want to be vaccinated?
I'm going to
Fred?
take that question. That's over to me. We've been very clear to not, we don't have to take a position on vaccine mandates because frankly, they exist now across all of our workplaces. Literally every sector that our members work in is subject to some form of requirement around vaccination, testing, et cetera. And so, as I said at the beginning of this, these are employer policies. The best of these policies, I would argue, is when the employer actually sits down with the union and tries to figure out together how they're going to implement these measures based in their health and safety framework from the vantage point that is this vantage point. How do we keep people from not getting sick? How do we keep people safe? This has been our main focus since the beginning of the pandemic. Thousands of our members have been infected and been sick. Dozens of our members have died. 2 members from my own local union have passed away. So this is it's been a very difficult time and a very difficult year and a half. Our main focus, and I want to recognize Paul here as one of our health and safety reps, mainly the only health and safety person we had on looking sort of after all kind of challenges we were facing in the midst of a global pandemic. Our focus has been on keeping people safe. And it's why we've said, we think that all of us should use every tool in our toolbox to keep people safe. That's why we've talked about the importance of enhanced ventilation at work. It's why we've talked about increased spacing, like in classrooms, but also in other workplaces. It's why we've fought hard to have, COVID-19 recognized as an airborne pathogen so that we could enhance PPE and we could talk more about the importance of ventilation. All of those things, including saying to our members, we believe that we should do everything we can to keep ourselves safe, and that includes vaccination. All of that to say, we also know that there are going to be members of ours who cannot be vaccinated for the grounds Daniel was talking about, or who ultimately feel quite worried about it still. And that's okay. It's understandable. It is part of being human. These days that we're in are very difficult insofar as we're being encouraged to be, you're either with us or you're against us. Are you in favor of mandates? Are you against mandates? Are you in favor of this? Are you against that? And here's what we're in favor of. We're in favor of keeping everyone safe. We're in favor of as few people getting sick and dying as possible. We're in favor of making sure we can try to stick together and work together and keep our teams together the way that we have been acting and working. That's the way we got through the first and second and third wave of these pandemics. It's quite challenging, this divisiveness that is amongst us and between us. But it's why we're doing things like this tonight, giving people information, real information, giving people access to confidentially ask questions beyond tonight. Because those of you on the line who are concerned, who are worried, who still have questions, that's okay. There are places you can go to get those answers. And at the end and at the beginning, you have the backing of your union because we are in this together. But I just want to be clear, like our goal is to keep people safe and healthy.
Thanks so much for that, Fred. And if I could just add that, we've always taken the position as well that harassment and bullying and termination is never the answer for anyone, and that we really have to treat each other with compassion to get people access to science and education to get beyond the hesitancy that they're experiencing. I'm going to go to another question. It says, can individuals refuse to work with unvaccinated fellow employees? So who wants to take that?
The practical answer is you shouldn't know if your coworkers are or are not vaccinated. So part of what we talk about is protecting your privacy rights. Your vaccine status shouldn't be disclosed beyond what's need to know, and coworkers are not going to be need to know because, you know, as Paul's talked about, of course, we're dealing with a wide range of measures that are there to protect workers in the workplace. And in light of all of those measures, it wouldn't be appropriate to broadly disclose an individual's vaccine status to colleagues in the workplace. And so kind of as a relate, you know, the next step in that analysis is that you probably don't have that right. The employer's obligation under the Occupational Health and Safety Act is to take all measures reasonable in the circumstances for the protection of a worker. Exactly how that is going to be implemented is going to vary from workplace to workplace, but it's unlikely that it's going to be necessary within that framework to give individuals the right to choose who it is they do or do not work with. So as a general matter, I would say no, you don't have that right to demand that from your employer.
Thank you so much. Can the employer require that I get a COVID test and pay for it at my own expense if I choose not to be vaccinated?
Yeah, also a good question. We don't know that answer yet. We know some employers are demanding that, whereas other employers are agreeing to pay for it themselves. I think there's a reasonably good argument that this is an obligation on the employer. This is a health and safety measure that's being taken into the workplace, and they ought to shoulder the cost. Do I know for certain that arbitrators are going to agree with me? No. There may be decisions going the other way that say, well, you could be placed on an unpaid leave and that's going to cost you a whole lot more. So surely you can pay for a test. But, you know, just my initial view of it is this is something that I think ought to be paid for by the employer.
Thank you, Daniel. And some of our members are asking about the effect of the vaccines on women's reproductive systems. Dr. Moriarty, can you address that?
Yeah, sure, happily. So this is one of the major forms of misinformation that has been circulating widely since the vaccines first became available. It is completely untrue that these vaccines affect women's or men's fertility. And that is something that's very important for people to know. It has been around for a long time. There's no biological basis for it. There is no evidence for it. There is no research to support it. It is completely fabricated. So it's one of the easiest ones to debunk or talk about because there's no basis at all for it. But it sticks around because people are obviously worried about that and they don't want vaccination to potentially affect them. So this is something I would say that if you have questions like this, come to our vaccine Q&A sessions. You can ask all variations on that and say, I heard this, this is what I saw, and we can explain it and break it down piece by piece by piece if you want. But that is a really one of the most common pieces of misinformation, and it's really discouraging a lot of women from getting vaccinated who may not realize as well that being pregnant itself puts you at much greater risk of severe COVID-19 and that you're much more likely to be hospitalized. Sorry, I just got bitten by a pet. And that, as you probably see from the stories that you're seeing on the news out of Alberta right now, that there have been some really extraordinarily tragic stories of pregnant women who've died and have developed quite severe COVID. So again, you can always come back to our sessions, but this is completely untrue, that information.
Thank you. If the employer is mandating the vaccine and something were to happen to an employee, whether it be severe or not, can the employer be held liable, and can an employee sue the employer?
So to answer the second question first, no, you're not going to be suing your employer. Those types of situations are going to be handled primarily through WSIB. particularly now that we're looking at employers who are making vaccination a term and condition of employment. There's a stronger argument to be made that any negative vaccine impacts that do arise rarely would constitute workplace injuries. And so the remedy, the primary remedy that workers would be going to in those circumstances would be to make an application for workplace safety and insurance board benefits.
Thank you. Next question. I have natural immunity as I was exposed to COVID. Why do I have to prove my vaccination status? Should I even get the vaccine if I've had COVID?
So I'm happy to answer that. So I would say absolutely. So we know that immunity from COVID infection itself doesn't last in some people. So you are at risk of developing COVID again. So for that reason, you should definitely get vaccinated. We also know that people who have had COVID and are vaccinated seem to have pretty fantastic immunity. It's kind of like the superpower immunity. So it's a really good reason to get vaccinated because you will be highly protected. And the other thing is that it depends on what variant you were infected with. It depends on how your immune system responded. So having a vaccination is kind of like your immune system seeing the virus again for a second time and developing a slightly different and ultimately stronger and more versatile response. And it's that sort of broad range of immune responses that are really critical and will be very helpful as well if new variants emerge. So I would strongly advocate for it. And I would tell you that just because you've had COVID-19 previously does not mean that you can't get it again and that you can't pass it on again. So I would definitely recommend it.
Okay, next question. Given that it appears the Delta variant can be transmitted by vaccinated people, why are only unvaccinated workers being asked to test regularly in the workplace? Tara?
Oh, that's a fantastic question. It's a really important question, right? So one thing I can tell people is that vaccination does reduce the ability of people to transmit or spread. So it doesn't completely wipe out the ability to spread, but it does reduce it quite a bit. And that has the effect in a population of people of really slowing down spread within the population so that the infection gets to fewer people. So in that respect, it is very important that people who are not vaccinated are being tested because they definitely pose a greater risk of infecting other people than people who are vaccinated. That being said, in some ways, I have questions also about why you would not test the unvaccinated and the vaccinated. I think that's a very legitimate point of view. I think that there is substantially less risk if you're vaccinated for the other people around you, but this testing criterion doesn't make complete sense to me either. And I think we'll see what happens. I think that may evolve. I think that was the early response to try to provide an option that would allow for somehow monitoring or reducing risk that unvaccinated people might pose to their coworkers and people that they care for or work with. But I'm not sure if that's going to be the only measure because on its own, it's not perfect. However, it is one of those layers, right? So if you have people doing checks and if you have people doing testing and if you have all of these different prevention measures at the upper level of that prevention triangle that Paul was talking about, you're reducing the chances that a case is going to come into the workplace and then be spread further. And when you're vaccinated, you have one more layer and a pretty good layer compared to a lot of the others that you have in addition to the other protections. So you are lower risk. And we're just going to have to see what happens about testing. I don't know if that's going to last forever.
Thank you. If I'm working with a coworker who discloses that he or she is not vaccinated, do I have the right to do a work refusal?
Well, look, you always have the right to do a work refusal under the Occupational Health and Safety Act. The real question is, will that work refusal be successful or produce any sort of positive outcome for you? Given how Ministry of Labor inspectors have been dealing with COVID issues in general, I think it's fairly inevitable that that work refusal would be rejected by the employer. And if you were to further it on to the Ministry of Labor level, it would fail at that stage as well.
Thank you. Several individuals have noted that requirements for vaccinations and other COVID precautions such as masks and tests are not articulated in the collective agreements. How can employers mandate these measures that are not covered in our contracts?
So there is in labor law a concept called unilaterally imposed employer policies. This goes back to an arbitration decision from 1965 called KVP that sets out kind of the right for an employer to impose new terms and conditions of employment in the workplace. They can do so as long as they don't conflict with a specific provision of the collective agreement. And it's important to understand what I mean by that. The fact that your collective agreement doesn't say anything about disclosing this information or doesn't say anything about vaccination doesn't mean it conflicts. A conflict would come up if there's a provision of your collective agreement that specifically says, for example, the employer shall not require employees to become vaccinated. I actually don't know of any collective agreements that say that. So the employers, as long as there's not an actual like directly conflicting provision, are allowed to impose any unilateral policy that is reasonable. Which is a word lawyers love to use because it means everything and nothing at the same time. What's reasonable, what's not. What the bottom line is that it goes back to this notion of a balancing of interests between employer interest and employee interests. And everything that I've talked about tonight in terms of what cases before have said employers are or are not allowed to do in terms of consequences for these choices are all from cases that did that balancing of interests under this 1965 KVP case. So that's why employers are allowed to at least do certain things, even though they're not set out in your collective agreement.
Thank you. Lots of people are concerned that the long-term side effects of the vaccine are unknown. How can we be sure that we will be safe years from now?
Oh, that's a really good question. It's a very common question. And so we can start in one place, which is to say that although there has always been sort of a lot of discussion or rumors or I guess urban myths in some ways that the effects of vaccines, side effects of vaccines can last for years, that is in fact not true. So side effects of vaccines that are tend to last for 2 to 3 months. So one example is Bell's palsy, which is common in response to other kinds of infections as well, not just vaccination. And sometimes Bell's palsy, which is when you get paralysis of the nerve that controls the muscles in your face, and you get facial drooping. That can last for 2 or 3 months before it goes away. The risk from any vaccination or many infections and dental procedures actually it's reasonably common. So vaccines actually don't have side effects that last past 2 to 3 months, except immunity. So the thing about our immune systems is that they have memory. They can remember what they've seen or encountered in the past. And that's actually what vaccines are intended to do. They're intended to show kind of like the mugshot or the snapshot of the virus or whatever it is to the immune system and say, this is the wanted poster. This is who you've got to watch out for the next time around. And then because our immune system remembers it later on when it actually encounters the real thing, it's actually had experience or practice and it can respond very quickly. So you want that to last. You want that to last for a long time. But the vaccines that are approved in Canada, especially the mRNA vaccines, mRNA is something that is extraordinarily unstable. So it's actually hard to get it to stick around for long enough to get an immune response. And it probably only lasts in our bodies for about 2 days, maximum 2 days. And then it starts disappearing quite quickly. And because of the way it's picked up, it doesn't get carried around the body. It's in the location where it's injected. And essentially what happens is that the cells, which make up our body, they eat that RNA. And then when they eat it, they say, this is something that is that I recognize as not being good. This is something that's foreign. And they start putting signs up sort of on their surface saying, I've eaten something that's not good. You need to do something about it. And that's what the immune system responds to. So that mRNA only lasts for about 2 days in our bodies, and it's cleared extraordinarily quickly. So the effects that people will have from vaccination are all related to the immune response. And you want that immune response to develop. It's just that in some people, under some circumstances, the immune response that you get can cause your body to can cause side effects in your body that you would get with other infections. So just like Bell's palsy, you can get it from other infections, from dental treatment, and other effects, other side effects of the vaccines are things that you typically see in response to an infection as well. And so the longest documented side effects of vaccines are 2 to 3 months. And we have far, far gone beyond that now, both with the trials, from the start of the trials last year. And there are absolutely, hundreds of millions of people who've been vaccinated with these vaccines now. We have more real-time data about these than we've ever had in history by orders of magnitude. And so we're watching. You saw that this spring when there were pauses, when there were concerns that there might be something wrong. Everyone paused, checked, made decisions. You were watching this process in real time when that happened. It's just that most of us are never aware of it. It all happens behind the scenes. But vaccines, it is a myth that vaccines have long-term side effects. It's been around forever. It dates back to people who claimed falsely that vaccines caused autism. And it's been really hard to get it to go away, but it is untrue and it's misinformation.
And some of the data and the science that Dr. Moriarty is citing, we will make those links available on our website so that they're shared with others. Daniel addressed this in his comments, but we're nearing the end of the webinar tonight. So I want to circle back to it because there's, dozens and dozens of questions like this. Something like this. The forcing of these policies is not choice, it's coercion. And so what about our human rights? What about our charter rights?
So, the answer to that question is that arbitrators and courts have examined vaccine policies before. And when workers are confronted with consequences up to and including an unpaid leave of absence from work as a consequence for choosing not to vaccinate, courts and arbitrators have said that, in fact, you do still have a choice. So that does not constitute, from the law's perspective, coercion. That may not, be something that resonates with you as a person confronted with that choice, and I respect that. But courts and arbitrators do say, at least up to the point of an unpaid leave of absence, you are still being offered a choice. It may be a choice with very difficult circumstances that pressures you into doing something you don't want to, but it is still ultimately, from the perspective of the law, your choice. Where the uncertainty arises is the next step, termination. Is a threat of termination stepping over that line and actually coercing workers into vaccinating against their will? And my answer is, I don't know. But there are certainly arguments to be made that say, yes, that does go too far. That is not appropriate. You don't need to go to the charter. You don't need to go to your human rights under the Human Rights Code. You can simply say that employers can't go that far as to coerce you into a medical procedure you do not want to have. But I have to be honest with you. And as I said before, there are going to be arguments that will be made against what I've just said, and that I do not know how an arbitrator or how a court will decide that case. We have to wait and we have to see.
Great. And can you tell us specifically what religions would have a legitimate exemption?
No, and no one can, because it's not up to the religion itself to decide. Individuals, the test is whether that individual has a sincerely held belief about their own religion or creed that prevents them from becoming vaccinated. The law is actually fairly clear. It doesn't matter if other people who also identify as a member of your religion don't share that belief. There doesn't have to be religious uniformity within a faith for your code protection to apply. So, if you have an employer saying, well, I've done research into Roman Catholicism and I've concluded Roman Catholics, are allowed to vaccinate, that's a fairly meaningless statement. The real question is whether or not, as a Roman Catholic or any religion, have a sincere belief that they are unable to vaccinate. So there is no list of religions that have valid claims. Like all Human Rights Code claims for accommodation, it is fundamentally individual. It is based on each and every individual worker and their specific circumstances.
Thank you. And with respect to privacy, does a supervisor have the right to receive the workplace screening? So for example, a member saying that they have to submit screening on a website link, asking if they've had COVID or other questions. Should the supervisor be getting access to this information, or should it be going privately and directly to HR only?
So it can't really be answered in the abstract because it's going to depend a little bit on your specific workplace and how it operates and some of the details of your vaccination policy and what are the consequences for workers depending on whether they're vaccinated or what their test results may be. There have been cases that have litigated that exact question. And some of those cases have said that frontline supervisors are allowed to have access to that information because that's necessary to implement the vaccine policy at issue in that workplace. But I wouldn't take from those cases that that principle applies everywhere. It may or it may not. So the principle that should be followed by unionized workers is that their personal medical information should be disclosed no further than is necessary in the workplace to actually operate one of these policies and to maintain a safe workplace. What that means in practice may be different depending on what your workplace actually looks like.
And is it true this vaccine is still in experimental stages?
No, this is not true. Again, that's a really important question though, because this comes up over and over again. So first of all, people need to know that this type of vaccine has been researched and has been used for treatment of cancer. Going back a couple of decades now, we have experience with these vaccines. It's just that they weren't used massively on a large scale the way we're seeing them being used now. So they go through a lot of different trials and that involve testing a lot of people before the data from those trials are looked at by regulatory agencies to decide whether they will be approved. And something that's very important for people to know is that so once they're released for use, they're still being monitored post-release, and all of these reports are being submitted related to adverse events, anything else that's related to the vaccines. This process is still going on worldwide, and will continue to go on for a couple of years for the hundreds of millions of people who've been vaccinated. So all these regulatory agencies in different countries are looking at this. independently of the companies who make them. So that process has been going on, and we still have the vaccines we do because they've made it through this process. And then the very, very final step, which is to say that we are absolutely certain that these vaccines are completely safe and should, in theory, not have to undergo any further regulatory approval, is for the Pfizer. And we will be seeing this likely soon for the Moderna. So it has passed into the category where there doesn't necessarily have to be a lot more regulatory oversight, but it is going to continue anyway for the next few years, not least because there are many parts of the world where people haven't been vaccinated yet, especially parts of the world where people may not have access to the healthcare that we have here. And because we need to monitor for a long time to make sure that nothing is happening that wasn't unexpected, because in another part of the world, it's starting to be an issue. So the Pfizer vaccine is completely approved, and the Moderna is probably not going to be long behind. They submitted all their paperwork a couple of months behind Pfizer. So it's likely that based on all the evidence we've seen so far, that there won't be any issue at all. So it's untrue that they are experimental vaccines. They're based on decades of technology and research. It just happened that all of that became available and possible at just the right time. And these vaccines have been like a grand slam home run. There are many ways that we wish that they could be better, but they have been extraordinarily fast and effective, and humanity as a whole has been really, really lucky that they worked out as well as they did. So I would like to express my enthusiasm for that, and that they're not experimental.
Okay, second last question, and then the last question is coming to you, Fred, but second last question. I'm too afraid to get vaccinated right now. What should I do?
Oh, that's a really important point of view. So here's what I'll say. You know what? Come and talk to me or other people one-on-one at the drop-in sessions that we have. There are many, many reasons people are afraid. They are all legitimate reasons, and they all make a lot of sense to people. So what I can tell you is that I and other people will answer every question, we'll listen, we'll provide accurate information for the things where we know what the answers are, and we will be with you. I know that may not be an immediate comfort, but what I can say is that we will use all of our knowledge and skills and training, and we will extend that and make that available to you so that we will be your resource. It's a very difficult situation, and I'm really sorry you're going through that. And it's also quite brave to say that, because right now a lot of people are not saying good things about people who are not vaccinated, and really don't understand that there are many people who legitimately have fears about vaccination, that they deserve our support and not our scorn. So that's all I was going to say. Come and see me and other people, and we're there for you.
Thank you so much. Last question to end our webinar this evening. It's going to you, Fred. Is CUPE going to stand up for the rights of employees that don't want to be vaccinated?
We are going to defend the rights of all of our members. It is what we do. I think you've heard from Daniel some of the realities and challenges that we're going to face there. And what we do as a union is absolutely to defend people's individual rights, but those individual rights are subject to the collective rights of our workplaces and the rest of our members, right? There is, again, a balance there. It's not all about any one of us, actually. Now, if your employer treats you unfairly, if they are, not properly implementing a policy, if they decide to terminate your employment, termination is the highest form of discipline. You can't get much worse than that. So we are going to do our best to work with employers and with members who continue to not be vaccinated to try to safeguard you as much as is possible. But our focus, our energy, the majority of our time is got to be spent keeping all the other people at work safe, keeping all of us on the right track here. Cases are rising. Our kids are back in school. We're not through this yet. So we will do our best to make sure that people are treated in the best possible way and as fairly as is possible. Our main focus is going to be making sure we keep as many of us as safe as we can to get us through this next wave of this pandemic.
Thank you so much. That does conclude our webinar this evening. I want to thank lawyer from Goldblatt, Daniel Shepard, our infectious disease scientist, Dr. Tara Moriarty, our health and safety representative, Paul Sylvester, CUPE Ontario President Fred Hahn. We are ending this webinar tonight with over 2,300 questions that have not been answered. I think this is clear that there is a huge demand for this discussion to continue. And I'm going to go out on a limb here and say that this is not going to be the last town hall on this question that CUPE Ontario is going to host. It's clear that you all have a lot of questions that still need to be answered, and that's what we're going to do. So please visit cupe.on.ca vaccine policy info to get access to any of the resources that were mentioned here tonight. And just as we go forward, I just want to encourage you to be kind to one another, have compassion for each other, and reach out and seek the education and access to the science and information that you need to get beyond any legitimate hesitancy that you're experiencing. But first and foremost, have compassion and be kind to each other. Thank you so much, everyone, and have a really great night. Bye.
Thanks, everyone. Stay safe.